The arrival of COVID-19 vaccine in Kenya is a welcome relief for many and to the efforts to contain the pandemic in the country. I'm Dr Mercy Korir, and joining me is Dr Collins Tabu. Dr Tabu works at the Ministry of Health. He's the head of the National Vaccines and Immunization Programs. Thank you very much, Dr. for joining us. So how many doses of the vaccine and which vaccine is Kenya expecting?
Unlike what is going on in the West, the vaccines we expect to receive this instance would not be the vaccines that require the ultra cold chain storage. These will be vaccines that require the regular cold chain storage of 2 to 8 degrees centigrade. So for us, we are expecting to receive the AstraZeneca vaccine is what would fit within our temperature ranges, the storage requirements of 2 to 8 degrees centigrade for deployment. Most of the vaccines we use within the routine immunization program, again, are managed within these temperature ranges. So we will receive about 24 million doses through the COVAX facility, but the government has also put in place measures, and it's going to invest in procuring an additional about 12 million doses directly, either directly or through the COVAX facility to further increase the population coverage for the vaccine.
So there have been many conversations around, the vaccines that have been developed for COVID-19. And one of the biggest issues, and especially for low and middle income countries, has been the storage requirements, that the vaccines require ultra cold temperatures. What efforts have the government put in place to make sure that the vaccine we are receiving keeps to the cold chain requirements, the temperatures that are required according to the manufacturer?
The plane that is shipping these vaccines is also fitted with that special kind of equipment. The strict 2 to 8 degrees centigrade temperatures are maintained all the way from the manufacturer during transport as the vaccines are flown in, during distribution process to the depots and the service delivery points, and even in the service delivery points as they await to be administered to the clients. At the airport, we also have cold chain storage facilities there, so they are not just sitting in some open space waiting to be cleared. No, from the plane they are transferred into cold chain storage that is at the airport before they are cleared and moved by a refrigerated truck to the national and regional vaccine depots. Far-flung areas, Turkana, Wajir, Mandera, the vaccines will be flown to them by air. The national government has established vaccine depots in those areas, so they're able to manage the strategic stocks of these vaccines. As they move to deliver the vaccines, then, unlike these other areas, they will be able to deploy them through some targeted outreaches in the far-flung areas within those particular counties, just to ensure the most deserving people are able to get them.
So you've been dealing with routine immunizations, measles vaccines, polio vaccines, tetanus, the routine immunization for children and, other vaccines that adults require. What is so different about this COVID-19 vaccination deployment plan or program for COVID-19 vaccines?
No two vaccines are actually the same in terms of their characteristics. Each vaccine is actually unique in its own way. For instance, even as the AstraZeneca vaccine is stored within the existing cold chain, there are special attributes that have to be considered during its handling. For example, the vaccine shouldn't be shaken vigorously during administration. The mode of administration for this vaccine is an intramuscular injection. Quite a number of the other vaccines is subcutaneous administration.
So when the vaccine comes, obviously it's coming through Nairobi. Where do you go from there next? Is it that Nairobi starts getting the vaccine, then other counties follow, or is it all systems go in the 47 counties? How do you plan to, distribute and have everyone who has been prioritized, as you say, receive the vaccine at the same time?
First of all, we have a vaccination strategy in place that assures that all regions, all counties really, will be able to access these vaccines in the first instance. So as the vaccines come in, we may start small by maybe starting in the county referral facilities through whom we access those critical populations, talk about the health workers, talk about the instructors in educational institutions, talk about our security personnel, then move on from those county 47, for example, county referral hospitals to cover all the other level 4, 5, and 6 hospitals that are within those counties. So we first of all are giving every county an opportunity to be able to start vaccinating in the first instance within the shortest time possible after arrival of the vaccine.
What is that target population which the ministry, the government is looking at to say now we think that Kenya has been vaccinated enough, Kenya is safe from COVID-19? What is that target population?
We anticipate to vaccinate the entire about 1 million people. This is because, remember, we're getting in the first instance 4.1 million doses. So it is only this first shipment that is 1 million doses. So in the next few days, later after following that, we will expect other shipments to come in. So we may not go very hard on ourselves to withhold vaccine from other individuals on account of the second dose, while we do know that people will require the second dose about 2 months down the line when we would already have received other shipments.
The country expects in the first batch 4.1 million doses of vaccine. This is roughly 2 million to vaccinate. How do you prioritize who to give the vaccine and when? Where? How do you go about this? Because 2 million out of a country of almost 50 million people, you really have to be very specific about who you choose for the vaccine. So how have you gone about this?
The 4.1 million doses will be able to fit all of those priority populations we are talking about. The country, with the guidance of our leadership, the program with the guidance of our leadership has gone through what we call a prioritization process. The objectives of the vaccine introduction, the first priority is first of all to assure the functioning, the continued functioning of the essential components of our economy. It means that we need to assure the continued functioning, for instance, of the healthcare system by protecting the health workers. We need to continue the functioning of the economy really by getting our security organs and everything else intact, getting our border areas manned and being able to function normally, and getting our institutions functioning normally, like now the schools are open. So the priority is really first of all to assure the continued functioning of critical sectors of our economy. Then from that, we're moving in the second phase beyond the 4.1 million doses, where then we will seek to protect the individuals that are most vulnerable, to death or to severe disease from COVID-19. And these are the people with people over 18 years old that have comorbid conditions, these chronic conditions, really long-standing medical conditions, and people who are aged over 50 years of age. So we aim to then move on to this sector. Then after that, we will move to achieve equity now by targeting the other vulnerable populations. People who are in congregate settings, for instance, the prisoners, the people in the care homes, the people who are in urban slum populations, for example, and all of that.
So in subsequent phases, you're looking at vulnerable people. People with comorbidities, could it be diabetes, hypertension, any chronic illness, and we know that the data in our country is wanting. So how do you know that this particular person is actually vulnerable? Is there a database, or how do you plan to go about this?
We do have estimates in terms of numbers, sort of like a database, but the approach to vaccination, remember, it will be much more that of self-reporting, that people will be able to volunteer information about their pre-existing medical conditions. Remember, we're not trying to be as restrictive as we can get in terms of people showing documentation for their pre-existing medical condition, but rather we're trying to be as inclusive as we can get to get everyone who may be at risk or who may be having these conditions or who may be elderly be able to access the vaccine.
How will the rollout of the vaccines be like? If I'm at the front lines as a healthcare worker, for example, Do I just walk into any facility and say, you know, I'm a healthcare worker, here's proof, get me a vaccine? How do you envision that you will carry out this actual vaccination of the individuals you've identified?
There will be a process first that will be followed to access the vaccine. First of all, people are not just going to walk in like the other routine services. We're going to have a process of pre-registration. So we will encourage people to, first of all, register to be able to access this vaccine. Now, this process of registering will also have a component of consent for vaccination in it. So once you have registered, you then provide your contact details, and the vaccination will be scheduled for you to the nearest center that will be offering that kind of vaccine. So given that we, in the COVID times, we have the COVID pandemic being active, we want to be able to control the numbers. We want to be able to schedule these. We want to be able to spread it out and get people to access the services as close to where they are as possible. There is a system that has been developed that will do this, but it's not exclusive. This is layering on the existing channels for communication, really, for the ministry and for the routine immunization program as it is. What we have done is we have continuously prepared, undertaken preparatory actions towards ensuring that as soon as the vaccine arrives, we're able to quickly deploy it. We're having our health workers trained. We're having the mapping of the cold chain equipment, the supply system done and ready to receive the vaccine. We're having the key messages developed for rollout to the communities and the target groups early enough. We are having the system ready to start pre-registration in the next few days for people to be able to access this vaccine, albeit starting with the county referral hospitals and then progressively moving to the other level 4 and 5 hospitals that are out there.
4.1 million doses is definitely not enough. That's just 2 million people of the entire population in Kenya vaccinated. What are the plans to make sure that as many people as possible get vaccinated? For now, the plan is to, as much as possible, maintain the same vaccine. Because you do realize a major shift to another vaccine would require, again, aspects of training, aspects of reviewing the handling procedures, and all of that. So unless circumstances force us otherwise, we do anticipate that we'll remain with the same vaccine. The information we have is that the vaccine is safe. For now, the information we have is that the vaccine is effective in preventing the COVID-19. We need to work together to be able to deploy this vaccine and take it up as fast as we can to be able to protect ourselves and ensure the continued functioning of the critical sectors of our economy, protect the most vulnerable people within our country so that we're able to reduce on the burden of disease and deaths from COVID-19 disease. Thank you very much, Dr. for your valued inputs on COVID-19 vaccine, even as the country prepares itself on this, long-term vaccination program, which obviously will not end within this year, but it's going to continue. So thank you very much. We've been with Dr. Collins Tabu, who is the head of the National Vaccine and Immunization Program at the Ministry of Health. Thank you for watching KTN News Health Watch. My name is Dr. Mercy Korir. Keep safe.